The smell of floor wax and recycled air was the first thing Dever noticed every morning when she walked through the sliding doors of Rideau Valley General. Not antiseptic, not coffee, floor, wax, and recycled air, the particular scent of a building that processed human suffering on a budget. She had smelled worse. She reminded herself of that every shift. Her boots squeaked on the linoleum. The night crew was handing off to days, and the hallway outside triage had that gray, unfinished quality of a place that never fully slept. A portable monitor beeped somewhere behind a curtain, the kind of low battery alarm that nobody answered for the first 6 minutes, because everyone had learned it usually resolved itself. Dever clocked it automatically. Bay 4. Loose lead on the chest cable, not the battery. She could tell by the pitch. She didn't say anything. She was 4 months into this job, and she had already learned that saying things was worse than saying nothing. Dever. Paulette was at the charge desk, not looking up from her tablet. Paulette ran the day shift at Rideau Valley the way a corrections officer ran a yard, with absolute territorial confidence and a complete absence of warmth. She was the kind of nurse who had been doing this for 22 years and had stopped seeing patients somewhere around year 14. Room 3 needs vitals charted. You're also covering the walk-in overflow today because Trish called in again. Understood, Dever said. Also, Paulette finally looked up. Her eyes moved over Dever the way a customs agent scans a bag, measuring, cataloging. Dr. Arsenault wants to see your documentation from yesterday's chest pain patient. He says your notes read like a field report. Dever set her bag down at the locker. I'll clean it up. It's not about cleaning it up. Paulette set the tablet on the desk. It's about the fact that you charted a capillary refill time to the 10th of a second and noted the exact angle of tracheal deviation. Nobody does that here, Dever. Her nurses don't write notes like that. The information was relevant. It made him feel like you were correcting him. Paulette picked the tablet back up. Just write what we write. Vitals. Assessment, intervention. Don't make it complicated. Dever nodded once. She opened her locker, hung up her coat, and stared at the back wall for a moment before closing it again. Outside the locker room, she could hear the shift-change chatter. Someone laughing about something that had happened on nights. The particular social ease of people who had worked together long enough to build a shared language. She was not part of that language. She was a new hire at 34, which in an ER meant she was either coming from somewhere worse or running from something. The staff at Rideau Valley had decided on the latter without ever asking her. She walked out to room 3. The patient was an elderly man with a history of hypertension who had come in because his GP was booked until March. He was reading a newspaper folded into quarters with the deliberate concentration of a man who had decided the wait was simply a fact to be endured. He looked up when Dever came in. His name was Bertrand. "Morning," he said. "Good morning." Dever wrapped the cuff around his arm. "How's the pressure feeling today? Any headaches?" "Bit behind the left eye," he admitted. "Not bad. When did it start?" "Woke up with it." He watched her work. He had the calm, observant quality of someone who had been around long enough to know the difference between someone who was doing a job and someone who understood what they were doing. "You're not from here originally." "No." "Where then?" "Here and there," Dever said. She pumped the cuff. She watched the needle fall. She noted the reading in her head before she entered it in the chart. His pressure was elevated but not critically so. She adjusted her documentation accordingly. Simple, clean, the way Paulette had told her. "That's a soldier's answer," Bertrand said. Dever didn't respond to that. She removed the cuff and told him the doctor would be in within the hour and that he should tell them about the headache if they didn't ask. He thanked her. She left. By 10 o'clock, the ER had filled up the way it always did on weekday mornings. The people who had waited through the weekend, finally deciding the thing that was wrong with them was real enough to address. Dever moved through the bays steadily, doing her job at the exact pace that had been described to her as too slow by Paulette and too calculated by Dr. Arsenault, and too quiet by Chloe, the third-year nursing student who shadowed Dever on Tuesdays and had apparently expected something more instructive. "You never explain what you're doing," Chloe had said last week. "I'm doing it," Dever had answered. "But how am I supposed to learn if you don't narrate?" Dever had thought about that for a moment. In her previous life, nobody narrated. You watched. You absorbed. You performed under conditions that did not allow for confusion. And if you were confused, the person beside you might not make it home. She did not say any of that to Chloe. "Watch the hands," Dever had said, "not the face." Arsenault passed her in the hallway just before noon, carrying a chart and speaking over his shoulder to a resident named Fontaine. She caught the name on his badge, not from the file, about a patient in Bay 7. Arsenault was the kind of doctor who had been told too many times that he was excellent. He was 41, worked with the contained arrogance of someone who had never been seriously wrong about anything medical, and he had made up his mind about Dever within the first week. "Walk-in overflow still backed up?" he said, not quite looking at her. "Down to 4 from 9, Dever said. "Good, keep it moving." He glanced at her once, a flicker of the particular condescension she had come to recognize as his resting expression when addressing support staff. "And Dever, the documentation thing. Paulette talked to you?" "She did." "Good." He moved on. The resident followed him like a tide following the moon. Dever watched them turn the corner. She exhaled slowly through her nose. The fluorescent light above Bay 6 was flickering at approximately 4-second intervals. She had mentioned it to facilities 2 weeks ago. It was still flickering. She turned back to the overflow board. The afternoon stretched. A dislocated shoulder. A toddler with croup. A man who had definitely broken 2 fingers, but kept insisting he had only jammed them and seemed personally offended that anyone was taking this seriously. Dever worked through it at the pace she always worked. Not slow, not fast, simply efficient in the way that had nothing to do with appearing efficient and everything to do with not wasting motion. She had learned that in a tent hospital outside Kandahar, where wasting motion was a variable you eliminated because every second counted differently than it did here. Here, the seconds were long and padded, and people mostly survived them. She was grateful for that most days. At 3:40, the emergency line at the charge desk rang with a tone that was different from the regular line. Not louder, just different. Dever was 10 feet away when it happened, and the hair on her forearms lifted before she consciously understood why. Paulette answered it. Her face changed. "How many?" she said. Her voice had dropped its administrative frost and replaced it with something tighter. Okay, when?" She listened. Her eyes moved around the department. Right, we'll activate." "Yes." She hung up the phone. For a moment she just stood there, grip still on the receiver. "Paulette," Dever said. Paulette seemed to surface from somewhere. "Multi-vehicle," she said. "Highway 417, bridge construction site. Scaffolding collapse. Workers were on it. EMS says at least 8 critical, possibly more. 10 minutes out, first rig." The ER shifted. Not dramatically, There was no movie moment where everyone snapped into perfect formation. What actually happened was the particular, messy, human scramble of people who had been trained for this, but still found reality more chaotic than the training. Arsenault started issuing orders in a raised voice that had an edge of strain in it. The resident Fontaine went very pale and started doing something with a supply cart that didn't need to be done yet. Chloe, who was still on shift, began asking questions that nobody had time to answer. Dever walked to the trauma bay. She took inventory. She did not run this by anyone. She simply looked at what was there and what was missing and moved to close the gap, the way she had closed gaps in environments where closing them fast enough was the difference between a trauma and a death. She pulled the chest tube kit to the front. She confirmed the rapid infuser was primed. She checked that the surgical airway tray was accessible and not buried under the intubation supplies. She positioned the O-negative blood in the small satellite fridge beside Bay 1 and noted the units available. 5. Not enough if the casualties were as described. "What are you doing?" Arsenault said behind her. "Setting up. I didn't ask you to set up. I'm coordinating this." Dever turned around. She looked at him without expression. "You have 5 units of O-neg. If you have 8 critical, you'll exhaust your blood supply before the 3rd patient. You should call for more now, not after you need it." Arsenault stared at her. "I know how mass casualty events work." "Then you've already called," Dever said. He hadn't. She could tell by the fractional pause before he turned away and picked up the phone. The rigs started coming in at 3:52. The first 2 casualties were the most stable of the group, which told Dever that EMS was triaging hard on scene and sending the worst last to give the hospital time to prepare. Standard protocol. She stood at the doors and watched the paramedics' body language as they rolled the 3rd gurney through. The way they moved told her more than the radio report had. The patient was a man in his mid-40s. Construction gear, partially cut away. His left arm was trapped below the elbow in a crush injury that had caused a traumatic partial amputation, and the tourniquet above it had been applied correctly but needed attention. His breathing was labored. His color was wrong. "Bay 1, Arsenault called, moving toward the gurney. Dever was already alongside it, walking. She looked at the man's chest. His left side wasn't rising evenly with his right. She looked at the trachea. Subtle deviation as she looked at the neck veins, visible even above the cervical collar. "He's tensioning," Dever said. "He's hypoxic from the blood loss," Arsenault said without looking. He was focused on the arm. "Get me a line." "He's tensioning," Dever said again. Her voice had not changed in volume. It had changed in something else. "Trachea is deviating right, JVD. Left breath sounds are absent." Arsenault looked up at her. His expression was the particular look of a man who is about to say something dismissive. The patient's blood pressure alarm fired. The number on the monitor was not compatible with someone who was simply hypoxic from blood loss. "Needle decompression," Dever said. She was already reaching for the tray. "Wait. He will arrest in under a minute." Dever pulled on gloves. She looked at Arsenault directly. "Tell me to stop or step back." The room was very quiet for a moment that was probably less than 2 seconds but felt longer. Arsenault stepped back. Dever found the second intercostal space, mid-clavicular line, without hesitation. She had done this by feel in the dark, in moving vehicles, in noise that made the current beeping of monitors sound like silence. She inserted the needle. The rush of air was immediate and audible. The blood pressure number on the monitor began slowly to recover. Nobody in the room said anything for a moment. Dever withdrew the needle and handed it off. He'll need a chest tube to maintain, and the arm is going to need vascular surgery, not just ortho. She stepped back and stripped her gloves. Next patient? Arsenal's jaw was tight. He didn't say thank you. She hadn't expected him to. The mass casualty ran for 2 hours. By the time the last critical patient had been stabilized or transferred, the trauma bay looked like what it was. A place where serious things had happened very fast, and not everyone had been ready for the speed of them. Dever was at the sink in the back hallway, working antiseptic soap into the spaces between her fingers, when Paulette found her. "Arsenault is writing an incident report," Paulette said. Dever turned off the tap. "About the needle decompression. About you bypassing his authority and performing an invasive procedure without his explicit order." Dever dried her hands. The paper towel shredded slightly at the edges. "The patient is alive." "That's not the point, Dever." "Then I'd be interested to hear what the point is." Paulette's mouth thinned. She had the look of a woman who had delivered this kind of news before and had stopped finding it satisfying. "The point is that you are a probationary staff member with less than 5 months on this floor. You don't get to override the attending. You don't get to make that call, regardless of whether it was correct." Dever looked at the wall. There was a motivational poster about wellness. The laminate was bubbling at the bottom corner. "I'll cooperate with the review," Dever said. "You'll need to," Paulette said. "Bring your documentation. The chief of medicine wants to meet with you tomorrow morning." Dever nodded. She didn't fight it. She walked back out to the floor, past the trauma bay, past the room where Bertrand had sat reading his newspaper that morning, past Chloe, who was standing at a computer terminal and who watched Dever pass with the expression of someone trying to work out a problem they didn't have enough information to solve. Dever sat down at her own terminal and started charting. She wrote it simply. She wrote it the way Paulette had told her to write it. She did not write what she had actually known in the moment she looked at that patient's chest. She did not write the particular quality of certainty that had nothing to do with protocol or training hours logged in this building, and everything to do with 8 years and 4 deployments and the specific repeating lesson that a tension pneumothorax in a chaos environment did not wait for committee approval. She just wrote what had happened. She saved the chart. She went home. The meeting with the chief of medicine was at 8 in the morning in a corner office on the 3rd floor that smelled like fresh paint and old carpet. Dr. Rideau, Yves Rideau, his nameplate said, a tall man with the precise posture of someone who had once been an athlete, sat behind a desk that was aggressively neat. Arsenault was there. Paulette was there. A woman from Human Resources whose name Dever didn't catch was there. "Miss Dever," Rideau said, "thank you for coming in." She had not been given an option about coming in, but she said nothing about that. "We've reviewed the incident report and the chart," Rideau continued. He had the measured tone of someone choosing words carefully, the way you did when you were not sure yet which direction the thing was going to go. "I want to be clear that we take patient safety seriously, and in this case the outcome was positive." He paused. "However, the manner in which you acted yesterday represents a significant breach of the protocols that govern how this department functions." "She physically moved me out of the way," Arsenault said. He was leaning against the wall with his arms crossed. "She performed a procedure without my authorization." "I stated my clinical finding twice," Dever said. "You did not act because I was assessing. The patient's blood pressure was 60 over palp and dropping," Dever said. At that trajectory, he had approximately 45 seconds before arrest. That is not an assessment window. That is a decision window. The room was quiet, be that as it may. Rideau said carefully, "You are a staff nurse, not a physician. The scope of your role here." "I know my role," Dever said. She looked at Rideau. She kept her voice exactly level. "I am not asking for recognition. I am telling you the patient is alive and the procedure was correct, and that those two facts are related." Renaud looked at her for a moment. Then he opened the file in front of him and looked down at it. "Your reference checks were very positive," he said, "though we did find some gaps in your employment history that were a bit difficult to account for. The periods between positions, I was deployed," Dever said. The room shifted slightly. Paulette's head moved. "Deployed," Rideau repeated. "Canadian Armed Forces, Medical Branch. I completed 4 tours, 2 in Afghanistan, 1 in Mali, 1 advisory mission I can't specify in detail." Dever folded her hands in her lap. Her knuckles were quiet, the old scars pale under the office lighting. "I held the rank of Master Corporal. My primary role was combat medic and trauma responder in forward operating environments. The procedure I performed yesterday is something I have performed approximately 30 times in field conditions, in environments considerably less equipped than your trauma bay." Nobody in the room said anything for a long moment. Rideau set down his pen. Paulette was looking at Dever the way Bertrand had looked at her yesterday morning, that slow, recalibrating look. Arsenault uncrossed his arms. "You should have disclosed that," he said, but his voice had lost its certainty somewhere in the middle of the sentence. "It wasn't asked," Dever said, "and in my experience, it tends to complicate things before it simplifies them." The door of the office opened. The administrative assistant appeared in the gap, her expression apologetic and also genuinely alarmed. "Dr. Rideau, I'm sorry to interrupt. There are people downstairs asking for a nurse named Dever. They came in through the ambulance bay." She paused. "They're military." Renaud looked up. "Military? Yes, they have. There's a patient with them. They say it's urgent. They said to find the medic named Dever, and they weren't going to take no for an answer." Dever was already standing. She didn't look at Renaud for permission. She didn't look at Arsenault. She nodded once at the assistant and moved to the door. "Mrs. Dever," Renaud started. "Review can continue after," she said, and she walked out. She heard them before she saw them, not shouting. Something worse than shouting, the low, controlled, compressed urgency of people trained to keep their voices down in situations that justified screaming. She took the stairwell because it was faster, pushed through the door to the ground floor, and came around the corner into the ambulance bay. There were 4 of them. JTF-2, she clocked it from the kit and the posture before she saw the patches. Joint Task Force 2, Canada's Special Operations Regiment, the people who trained in places that didn't appear on official schedules. They were in kit that was wet and dark, with something that wasn't entirely water. 3 of them were standing. 1 was on the gurney. The one on the gurney was a woman, mid-20s. She'd taken shrapnel in the right side of her chest during what had clearly been a fast rope exercise gone wrong. Dever could see the nylon fibers still embedded at the entry wound, and the angle of it told her the impact had happened at height and velocity. The junior medic on the team had packed the wound and was maintaining a seal with his hands, and the expression of someone who had been doing that for longer than he wanted to. The lead operator turned when Dever came through the door. She recognized the rank insignia first. Warrant officer. His name tape read Cadio. He looked at her for precisely 1 second, Dever, he said. Not a question. Report, she said. He gave it the way she had been given reports in the field. Fast, ordered, without editorial. Fast rope insertion drill. Equipment failure. The patient had taken a hard fall and caught the edge of a steel cable housing on impact. Shrapnel penetration right thorax. Suspected pneumothorax given the blood pressure trend over the past 18 minutes. 2 units of saline on scene, but no blood product available. She had been conscious for the first 12 minutes and had stopped being conscious about 6 minutes ago. Dever was moving before he finished. Bay 1, she said to the orderly standing frozen near the wall. Now, tell Paulette I need O-neg and I need the thoracic kit, and I need anyone not currently working a critical to clear out. The orderly moved. Cadieux walked alongside the gurney, his hand on the frame. His face had the particular controlled blankness of a person who was keeping themselves functional by not allowing themselves to feel the thing they were feeling. Dever recognized that too. She's one of ours, he said. His voice was very even. I understand, Dever said. She's 26. I understand, Dever said again. They pushed through into Bay 1, the junior medic. His name tape said Trask. Kept his hands on the wound seal until Dever's hands replaced his. And then he stepped back with the careful discipline of someone who knew when to transfer authority. She felt the warmth under her gloves, the particular pressure of a compromised thoracic cavity, and she ran her hands over the entry site and assessed. Arsenault appeared in the doorway. He looked at the patient. He looked at the 4 operators filling the space behind the gurney. He looked at Dever's hands. He did not say anything for a moment. What do you need? He said. Chest tube, 32 French. The thoracic kit, top left of the cart, not the standard one. And I need you to get on the phone to Civic and see if they have a thoracic surgeon available for transfer consult. Dever didn't look up from the wound. She's going to need a surgeon, but she needs her thorax decompressed first, and that I can do. Arsenault moved to the cart. He found the kit she had described. He handed it to her. I'll make the call, he said, and stepped to the wall. Paulette appeared with the blood. She set it up without being asked, primed the rapid infuser, and stood at the head of the bed, watching Dever work with the expression of someone revising a calculation they thought they'd already finished. Dever worked. She didn't narrate, she didn't explain. She did the thing she had learned to do in conditions that stripped everything down to the essential. And the essential was this. There is a person in front of you, and the problem is defined, and you solve it with your hands and your training, and the cold, focused portion of your mind that does not admit anything else until the problem is solved. The chest tube went in. The collection chamber filled. The monitor, which had been tracking a blood pressure that made everyone in the room quiet, began the slow, grinding climb back towards something survivable. Cadieux let out a breath that he'd probably been holding since the ambulance bay. Trask bowed his head for a moment, just a moment. Dever stripped her gloves and pressed 2 fingers to the patient's wrist. Pulse, thin but present. Stronger than 2 minutes ago. She looked at the monitor and then at Arsenault, who had come back from the wall. Civic has a thoracic surgeon, he said. Transfer team is en route. 15 minutes. Good, Dever said. She needs to stay on the blood until transfer. Keep the seal and monitor the tube output. If it exceeds 200 in the next 10 minutes, call me. Arsenault nodded. Dever stepped back from the bed. She pulled off her gown and dropped it in the bin. Her hands were steadier than they had been in the hallway outside Renault's office. That was the paradox she had never been able to fully explain to anyone who hadn't lived it, that the harder the situation, the simpler everything became. It was the normal days that were difficult. Cadio was beside her. He was taller than she was by about 8 inches and was carrying approximately 40 extra pounds of equipment, and he was looking at her with the particular respect that had no performance in it, the kind that came from watching someone do a thing correctly under pressure. "You left the forces," he said, "4 years ago. Why are you here?" Dever looked at the bay. At Paulette adjusting the infuser. At Arsenault on the phone, his voice quiet and professional, nothing in it now of the man who had filed an incident report 12 hours ago. At Chloe, who had appeared in the doorway and was watching everything with the focused, absorbing attention that Dever had been trying to teach her, and that Chloe had apparently needed a different classroom for. "I needed something quieter," Dever said. "Cadio considered that." "And is it?" Dever almost smiled. "Not today." He almost smiled back. Then the transfer coordinator appeared, and the room reorganized itself around the logistics of moving a patient, and Dever moved aside to let it happen, because the thing she had trained for was done. Rideau found her at the sink in the back hallway 20 minutes later. She heard him coming and kept washing her hands. "The review is canceled," he said. Dever shut off the tap. "Dr. Arsenault has amended his incident report," Rideau continued. He paused. "He describes your intervention as, and I'm quoting, clinically appropriate and likely life-saving." Dever dried her hands. The paper towel held together this time. "I'll make sure your contract reflects your actual qualifications," Rideau said. He paused again. "We should have asked. I apologize for that." She turned around. She looked at him. He was, she thought, genuinely trying. "Make sure the blood supply protocol is updated for mass casualty events," she said. 5 units is not enough." He blinked. Yes. I'll have that reviewed." "Thank you," Dever said. She walked out to the floor. The afternoon shift was starting. The board had 7 patients in it, none of them critical. The light in Bay 6 was still flickering. She walked to the house phone and called facilities. She described the light, the bay number, and the duration of the problem. The person on the other end said they'd send someone. She said thank you and hung up. She sat down at her terminal and began to chart. Nobody called her slow that afternoon. Nobody commented on her documentation. Chloe stopped by once on her way out and stood at the edge of the desk for a moment, in the particular way of someone who had something to say and was figuring out how. "The hands," Chloe said finally. "I was watching the hands today." Dever looked up. "You're right," Chloe said. "That's how you learn it." She left. Dever watched her go. Outside, the Ottawa evening was coming in gray and cold off the river, the way it did in October. Pressing against the sliding doors every time they opened, the ER ran on, the monitors beeped. The linoleum squeaked underfoot. Someone in the walk-in overflow was having a conversation on speakerphone that nobody had asked to be part of. Dever finished her chart, closed the tab, and opened the next one. Her shift wasn't over yet.